I'm Vanessa Gormley. I'm one of the nurses at the Massachusetts General Hospital Fireman Vascular Center. You may have remembered me from previous segments that we've done with Chelsea Cable Access, where we talked a little bit about ischemic stroke and healthcare proxies. Today we're actually going to be speaking about hemorrhagic strokes, and I have one of my colleagues here, Christina Matthews, who's a nurse practitioner with us, and we actually have a survivor here today, Chelsea's own Terry Curtis. So let's start off with actually just identifying, Christina, what is a hemorrhagic stroke?
Thanks, Vanessa. It's really great to be here. A hemorrhagic stroke basically just means bleeding into the brain. I think in your previous segment you talked a little bit about ischemic stroke, which is a block in one of the vessels in the brain. When we're talking about hemorrhagic stroke, we're talking about bleeding into the brain. A little bit different.
Yeah, I can understand that. And in a previous segment we had mentioned that there are about 795,000 strokes that occur in the United States annually. And 13%, or that's about 100,000 of these strokes, are hemorrhagic. And there's actually two types.
There are. So we basically, when we are talking about hemorrhagic stroke or bleeding in the brain, what we're really looking at is where in the brain is that bleeding occurring. And based on that, what is the cause of the bleeding? And that's how we then determine the type of hemorrhagic or bleeding stroke. So basically we have an intracerebral hemorrhage, which is bleeding generally in any area of the brain. And we also have a subarachnoid hemorrhage, which is bleeding in a very specific area of the brain known as the subarachnoid space, which usually is due to very specific causes.
Okay, I tell you, this brain is complicated. So you have an intracerebral hemorrhage, which is really just kind of bleeding inside the brain. And then this subarachnoid bleed, which is just really a really particular area.
It is, that's it exactly, and normally due to a particular cause.
Okay, so what are the causes of subarachnoid or intracerebral hemorrhage?
So normally when we're looking or assessing or evaluating a patient who comes in with a subarachnoid hemorrhage, that's usually due to bleeding because of a vessel of some kind. So it may be what we call an arteriovenous malformation, abbreviated AVM, which basically is a tangle of blood vessels that bleeds, or what many people may have heard of in the past, which is an aneurysm, which is a little bubble on one of the vessels that pops and bleeds. Those two types in particular cause a very specific type of hemorrhage, which is bleeding into the subarachnoid space.
Okay. Now, what kind of signs or symptoms might someone have with this bleeding into the brain?
Yeah, so probably the most common symptom, the one that almost every patient will say that they experience when they have a subarachnoid hemorrhage, is the worst headache of their life. That's across the board. Almost everyone will tell me that. I've felt the worst headache of my life. Many times they may experience additional symptoms, so some other symptoms come along with that, which may be neck stiffness, they may get nausea and vomiting, they may get severe pain behind the eyes. Those other symptoms normally don't come alone though. They almost always will come with the worst headache of your life. So you're looking usually at more than one symptom that comes together that usually will let someone know that something is very wrong.
Okay, so if I'm having all of a sudden this really significant headache, worse than I've ever had before, along with either this neck stiffness or that sudden pain that kind of comes along, it's not just the headache, it's the pain above the eye or sudden double vision, I need to do something about it.
Absolutely. In those instances, you should not hesitate. 911. Just call 911 immediately and get yourself to the closest hospital so that you can be assessed.
Right. No driving to the emergency department.
Absolutely not.
Call 911.
911 and we would prefer that you not have a loved one drive you. 911.
Right. The ambulance can get me there faster.
Much faster. And there will also be evaluating, assessing, trying to figure out what's wrong with you on the way to the hospital. And they're talking with the doctors in the emergency room on the way, so that we're already getting a lot of information about what happened to you before you even get there.
Oh, so things can move much faster.
Exactly. So when you arrive, we've already got things going. We already know what we're expecting, and we can already get ready to do what needs to be done to help you be well.
Okay, so when I get to the emergency department, let's say I go to the Mass General ED, what happens next? Like, how do you treat me if I have a hemorrhagic stroke?
So normally when you arrive, there will be nurses, doctors ready to look you over, to do an exam, to try to figure out what's happening. What symptoms did you experience, which is when you'll tell us it was that worst headache of my life that came on suddenly, and any other symptoms that you may be having. We'll get a little bit of history from you. We'll talk to your family members and try to determine what's been going on. You'll probably see a neurosurgeon. It's to be expected. We want to make sure if there truly is some bleeding, what's happening. And more than likely, one of the first things that will happen is you'll get a CAT scan. So we will take you into a scanner where we'll do some imaging of your brain to try to really get a good look and assess, is there truly a hemorrhage there? And if there is, what type of hemorrhage is it? Like we spoke of earlier, are we looking at an intracerebral hemorrhage, or are we looking at a subarachnoid hemorrhage? That helps to point us in the right direction of what might be happening and what do our next steps need to be to make sure that you're okay.
Okay. So let's say I get that scan, you see a bleed in my brain. Let's say it's from a subarachnoid hemorrhage, and as you've mentioned, if it's a subarachnoid hemorrhage, most likely it's from an AVM or an aneurysm. So what would be the next step for me in that situation?
So once we determine for sure that there is bleeding and that it is due to either an AVM, an arteriovenous malformation, which is that tangle of blood vessels, or an aneurysm, which is that bubble that popped, once we see either one of those two things, we're going to then put in place the steps to fix it. So our first step is to make sure that you're stable, to make sure that you're safe, to make sure that everything is okay. Then we're going to start to plan out how do we need to make sure the bleeding has stopped and how do we prevent that bleeding from happening again. So more than likely we'll need to do a procedure, a surgery perhaps of some kind to protect you from that happening again. So to repair, to fix the vessel that has bled and to make sure that it doesn't happen in the future.
Do you fix those aneurysms differently? You mentioned it was kind of like a little balloon on top of a vessel.
Exactly. So there are two ways that we can do surgeries to repair these vessels. One is where we actually have to do a surgery called a craniotomy, which is where we actually have to open up the skull. The other is where we can actually go in through the vessel. So the femoral artery, which sits at the top of your thigh, will go into that vessel and just get right up to where the bleeding has occurred, to either the AVM or the aneurysm, and repair it. Either way, what we're trying to do is repair that vessel so that no bleeding occurs again in the future.
Wow.
It may be a long hospital stay for somebody who's had a hemorrhage, a bleeding of this type. Normally, they're in the hospital with us for about 2 weeks or so. There's many reasons why we do that. Ultimately, the goal is to make sure that you're safe and that we've taken care of everything to prevent another bleed in the future.
I definitely want to be safe before I leave the hospital.
Absolutely.
And make sure I don't have this happen to me again, perhaps.
Right.
What do you see commonly with patients who have been in the hospital for a little while? Like, what are some of the complications that can occur?
Yeah, so normally prior to anyone going home after they've had a hemorrhage or a bleed in the brain, we are sure to have physical therapy, occupational therapy. The therapists come and really do a very thorough assessment, really see how you're doing. Can you walk? Can you get yourself to the bathroom safely, alone? Can you fix yourself a snack? Can you get a drink of water? How is your memory? All of these little day-to-day things that we normally do might not be quite there after someone's had a hemorrhage. So we bring in a lot of people to really help us make sure that this person is safe. If there's any question, we may recommend going to a rehab facility to help you recover and get back the ability to do those things. And then some of the things that people experience, even going forward after being discharged, some problems with memory sometimes, some problems with concentration. Sometimes there's a little bit of sensitivity, so difficulty dealing with bright lights and crowds and loud noises. And those things can take a little bit of time to get better.
Okay, so this is really similar to when we chatted last time about an ischemic stroke, where a lot of times after that injury to the brain, it takes a while for you to kind of get over that injury.
Exactly.
You have this newly acquired brain injury, and there's a lot that kind of comes with it. I think it's a wonderful time to bring in our survivor, Terry, to really tell her story about what happened to you and how you felt in the recovery process.
Sure. Well, over 30 years ago, I was at work and didn't feel well, and before I knew it, I woke up in a hospital, at which point I was diagnosed with an AVM. And over a 2-year period, I had several procedures to reduce the size and then remove the AVM. And for about 30 years, I recovered probably over a 2-year period. I had a lot of recovery. And then I led a really great, wonderful, normal life, was able to work and live fully. And 2 years ago, I was in a hotel by myself and getting ready for bed. I sneezed, and I suddenly felt that worst headache of my life that Christina had explained. And I noticed that I started to go numb on the right side of my body, and I realized, I felt a terror, and I realized that I was in a lot of trouble. And I got to the phone in the room, and I realized I couldn't really see. But having dialed the phone many times, I was able to get the front desk and say, I need 911, I need an ambulance, and they arranged that. And I was brought to a hospital, and then I was transferred. I was in a different state at the time, and I was transferred closer to home to MGH, and they took very good care of me. And it took a while to recover from that. I had some visual problems and lethargic and tired and emotionally troubled. And it took about probably a good year before I started to feel really well. And now I'm almost 2 years in. I feel great. I feel almost back 100% to normal.
It's wonderful.
That's such an amazing
Isn't it?
story.
Yeah.
I think it's a good reminder for so many of us to really make sure that when we have symptoms that just aren't right and you're feeling scared and you're nervous, you should never go back to bed. Thank God you call 911, you called the hotel operator to say, get me help right away. If you didn't self-advocate or make sure that someone was going to take care of you at that moment, and if you decided to go back to sleep, you might not be here with us right now.
Yeah, absolutely.
So
Yeah.
it's really tremendous that you identified that something was wrong, that this headache was not common for you, and you got the help that you needed. In terms of your recovery, did you participate in any of that physical therapy or speech therapy that Christina had mentioned?
I didn't need any of that. Close to my release from the hospital, I did have an occupational therapist come and assess me and did all the things she described and made sure I was able to do things to take care of myself. And since I was able to do that, I was released. The things after that I noticed that were different about me as a person were that, a lot of stimulation was very difficult to deal with initially, and that's gotten better over time. So
How long do you think that's taken to improve?
I was probably started to round the corner about 18 months after the initial onset.
Mm-hmm. And I think that's one of the things that we see that's very challenging, is that the recovery can be a long process. It's not a recovery that's days and weeks. It can sometimes be a recovery that's months and even into 1 to 2 years, 18 months, 2 years, to really start to feel like you're yourself again. Like you've kind of, that fog, so to speak, has lifted and you've turned that corner.
And that must be really hard to kind of say, why aren't I better now?
Exactly.
And especially when you look the same.
Right. That's a wonderful point, Vanessa, and I think one that sometimes people aren't readily aware of, don't see immediately, is that there's no cast on your leg, there's no broken bone, there's no visual sign obvious when you look at someone that something has happened, because it's all in the brain. So I think it's important, and maybe you struggled with this a little bit, Terry, that people realize that even though the person looks the same, there's a lot of recovery going on there. There's been a significant injury, and there's still a lot of recovery happening.
Mm-hmm. I would agree that, many people say to me, you look like there's nothing wrong, but inside, initially, particularly in the very beginning, you're feeling like, but I'm not the same, and you're different, but you don't always know how to say it. Like, this is what's different about me. Mm-hmm. You just know that you're having some difficulties and challenges that aren't visible to everybody.
Yeah, and that must make you feel kind of alone because people don't get it. And,
right.
Who can you turn to? Who can you find that might have gone through the same, experience you have? And 100,000 seems like a lot, but maybe across the country it really isn't.
No, it's really not. It's really not. And I think that it's important to seek out resources. Support groups. There's Terry comes to our support group at Mass General, which is wonderful.
Yes.
There are resources out there, and seeking those. Trying to talk to people, talk to your providers, the doctors, the nurses. Ask, who can I? Is there anyone I can talk to? Who can help me with this? Who can help me realize that what I'm going through is not abnormal, is the same as what other people have gone through that have had this bleed.
And I think that's where your expertise and support comes in too, Christina, because maybe a general practitioner, a general doctor might not have all of this information, or maybe doesn't have any experience with an aneurysm or AVM survivor, hemorrhagic stroke survivor who comes in and is experiencing all of these, anxieties or changes in their brain and how they kind of cope with day-to-day living.
Right.
Where you in neurosurgery, seeing this all the time, you kind of know about, you've experienced this with some of your other patients, you have these support groups that are super helpful.
Absolutely.
So following up with neurosurgery and really
key.
going to see the folks who know best are.
Absolutely, absolutely. And we try to share that with everyone. Please reach out. Reach out to someone. Reach out to me. Reach out to your doctors, nurses, friends, colleagues, to try to get some resources in place to help you through. It's really important. It makes all the difference.
Yeah, I'm sure. Well, thank you both for being here today to educate the Chelsea community on hemorrhagic stroke. And Terry, thanks so much for sharing your story.
Thanks, Terry.
You could be saving a life 100% with sharing what you did, what you went through, and your recovery. So thank you very much. Thank you all for watching. Just to briefly recap, and as you know, there's going to be slides directly after this segment that you can review. So we discussed hemorrhagic stroke, the two main types of that bleeding in the brain, which is the intracerebral hemorrhage, so bleeding inside the brain, and that subarachnoid hemorrhage, which is kind of bleeding into a very specific area. The subarachnoid hemorrhages are primarily caused by those aneurysms or the arteriovenous malformations. The intracerebral hemorrhages can often be caused by anything from high blood pressure that's really poorly controlled. Maybe you're not taking your medications as well as you should, or maybe even something like trauma, like a fall or a car accident. We talked about the significant importance of any time you have a sudden symptom of worst headache of your life, that sudden double vision or that sudden numbness on one side of your body, the sudden inability to be able to speak, that you really need to call 911 right away. Don't mess around, don't ask for help, don't fall back to sleep. Call the people that can take you to a hospital as soon as possible. And then we talked a little bit about the treatment options. The good news is that we can stop the bleeding in your brain. We can help you get better, and you can have a really tremendous recovery like Terry has had twice. So there are plenty of things that we can do at the hospital to help you. So please, please, please make sure you get to the hospital right away. Doesn't matter which one, because if that hospital doesn't take care of bleeding in the brain, you'll be transferred to one that can. And I think we talked a little bit about maybe some risk factors, but just to review them really quickly, some risk factors for bleeding inside of the brain could be anything from drug abuse, alcohol abuse, like I mentioned before, that high blood pressure. Am I missing any, Christina?
Smoking is
Smoking.
key. Smoking is a big one.
Yes, we hear that a lot. So no
Yes.
smoking. We really gotta, if you are smoking, please, please, please try and quit. Also, if you have a family history of any of these aneurysms or AVMs, you are at risk for having one yourself.
You should speak with your provider about it for sure. Speak with your doctor. You can speak with your primary care doctor, just to see if there truly is an increased risk for you. And then with a simple image, a CAT scan, we can try to see if any of those things exist before they become a problem, before they become a hemorrhage or bleeding in the brain.
Okay, so it is really proactive and important for you to chat with your family about any kind of
Absolutely.
medical issues that have kind of occurred, because you might be at risk.
Right.
Okay, cool. Well, thank you again, everybody, and thank you for watching. Take care.